Hello everyone and welcome to this video on high blood pressure or hypertension. This series of videos is going to be named Current Trends in Hypertension. The target audience is really anyone with interest in high blood pressure. If you're someone with high blood pressure, you probably would benefit. If you're a physician who treats high blood pressure, you'll find a lot of useful information. I'm Dr. Mohammed Tinawi. I'm a nephrologist in Northwest Indiana. You can find more about me in the description below. In part one, we're going to discuss the definition, prevalence, goal of treatment of high blood pressure, and the best way to measure blood pressure. Let's get started. First, let's start with some definitions. The definitions are based on the 2017 report by the American College of Cardiology, American Heart Association report. This is a very important report. Anyone with interest in high blood pressure should be familiar with it. In this report, the definition of a normal blood pressure is a systolic blood pressure less than 120, and you need both, and a diastolic blood pressure less than 80 millimeters of mercury. Now, notice that we don't have a lower number, so less than 120. Is 80 okay? No, it's not okay. But really, some people have blood pressure of 90 over 60 or all their lives, and they're fine with it. So this is more like the upper range of normal. We don't quite know what the lower range of normal is. Elevated blood pressure is defined as systolic blood pressure between 120 to 129 millimeters of mercury, and that's it. The diastolic should still be below 80. If the diastolic blood pressure is above 80, then automatically the person has hypertension. Okay? Stage 1 hypertension is systolic 130 to 139 or diastolic 80 to 89. So if you have a patient with a systolic blood pressure 121, for example, and the diastolic is 82, then they have stage 1 hypertension. They don't just have elevated blood pressure. Stage 2 hypertension is when you have a systolic of equal or above 140 or a diastolic of equal or above 90 millimeters of mercury. And different societies have different definitions. This is probably the easiest and the most widely used nowadays. How common or prevalent is high blood pressure? Well, hypertension is very, very common. First, we have to define what a high blood pressure is. We just said we need a systolic of equal or above 130 and a diastolic of equal or above 80. Based on that, 45.4% of the US population has hypertension. Now, this is an increase by 14% because the previous definition was over 140 over 90. So by lowering the definition of hypertension, we increased the prevalence of hypertension by 14%, and most of this increase came in the age group between 22 to 44. Now, worldwide, the prevalence is 31% based on 2010 data. Now, you notice that I have the references on the screen, and I'll also put them in the description. What is a good blood pressure target or goal? Well, first we need to calculate cardiovascular risk. There are online calculators where you can do that easily. If the cardiovascular risk is 15% or more over a 10-year period, then the goal is below 130 over 80 millimeter of mercury. This applies to patients with other comorbidities, other diseases, or not. So if they have diabetes, if they have chronic kidney disease, if they have heart disease, the goal would still be below 130 over 80. For patients with chronic kidney disease, going below 140 over 90 does not help their kidneys, does not help in retarding the progression of chronic kidney disease, but it still has clear cardiovascular benefits. Now, the KDIGO, the 2021 Kidney Disease Improving Global Outcomes, recommend even less than 120 over 80 for patients with chronic kidney disease because of cardiovascular benefits, but they admit that the benefit is less certain in patients with diabetic kidney disease, with stage 5 chronic kidney disease, with albuminuria over 300 milligram per gram creatinine. Let's not worry about that. Let's just remember below 130/80 for everyone. How do we measure blood pressure? Well, the person should be sitting in a chair. The feet should be touching the ground. No smoking for 30 minutes prior to the measurement. The rest should be for at least 5 minutes. We should choose appropriate cuff size. The apparatus should be at the same level of the arm. All these things you know. Then we either take at least 2 blood pressure measurements in the office over 2 visits, or if we can, we do 3 separate measurements in the same setting, 1 minute apart, and then we confirm, if possible, if we can, with ambulatory measurement or at-home measurement. That would be even better. And this is what's happening now with the clinical trials. More on that in a future video when we talk about the SPRINT trial. Finally, which device to purchase? In this video and in any of my videos, there is no commercial endorsement whatsoever. There is a good website. It's validatebp.org, and you have a list of blood pressure devices in the United States that are tested independently, and the list is published by the American Medical Association. If you go to the website, you see that, and the advantage is it gives you all the validated brands. It will give you all type of devices. So whether you're looking for a home device, whether you're looking for an office device, automated, etc., you will find it. I'm going to end here. See you in the next video.